Crowds of young people out in force despite the coronavirus threat.
Huge crowds gathered at parks and beaches across the country.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
I mean, if it's up to us, then let us handle it how we want to.
Over the past 16 weeks, the coronavirus has made landfall in nearly every country in the world, with over 2,665,100 cases and over 185,500 deaths, with Canada having the 13th highest case total. In the early stages of the virus, many asked one question: is it containable? CBC published an article on March 2nd declaring that COVID-19 was not in fact containable. They stated throughout the article that the virus will be globally transmissible. In their article, it was stated how, quote, some medical experts believe that the containment stage has long since passed, that the spread of COVID-19 is inevitable, and that living with the coronavirus could soon become a reality, end quote. CBC News article, experts cast doubt that spread of COVID-19 can be stopped, was my initial article. The other two being Canada's national observers, aggressive measures needed to track and contain spread of COVID-19 in Canada, and CTV News, PM Trudeau, this will be our new normal until a vaccine is developed. In the same article, on March 2nd, the World Health Organization claimed that the virus was still in the containment phase. Michael Ryan, Executive Director of the WHO Emergency Program, explained that by containing the virus and interrupting transmission, it would be stopped. Isaac Bogoch, an infectious disease expert, disagreed with the statement made by WHO. He reiterated that measures such as closing borders, restricting or stopping travel, or blocking trade will not stop the virus. It'll only delay it, buying Canada a few weeks. Canada's National Observer's article was published a month after CBC's, yet the argument remained unchanged. The delay of stricter measures imposed by the Canadian government will result in the rapid spread of the virus and force harsher social distancing measures. Therefore, stricter measures must be taken immediately. In recent weeks, Alberta implemented a $1,000 fine for those who violate isolation orders. The fine increases for more serious, subsequent offenses. Additionally, contact tracking is a crucial step to slowing the spread. Medical and nursing students phone individuals who have been in close contact with someone with the virus, ensuring that they are aware of their diagnosis and act accordingly. If the contact trackers are unable to reach those individuals, paramedics are sent to their home addresses. These measures ensure that people who have been in recent contact with an infected person self-isolate to decrease further spread of the virus. My third source, CTV News, relayed the most jarring information out of the three. The article declared that the coronavirus will become our new reality, and this pandemic will not be over until a vaccine is administered. According to the article, a projected 44,000 Canadians could die from COVID-19 in the months ahead if stricter measures are not taken. With no control efforts in place, up to 80% of Canadians could contract the virus. That scenario would result in a summertime peak with more than 300,000 deaths. Deputy Chief Public Health Officer Dr. Howard Najou said it appears that the first wave of the virus will last until the summer, and that won't be the end. Furthermore, Prime Minister Justin Trudeau spoke to the possibility of several smaller outbreaks of COVID-19 occurring. Public health measures could be needed for the next 6 to 8 months, or for as long as a year and a half. Throughout my research, I have concluded several things. Number 1, the virus cannot and will not be eradicated until there is a vaccine. Number 2, social distancing and isolation, as well as other public health measures, will only slow the spread of COVID-19, not stop it. Number 3, public health measures are effective, although they are effective in only slowing down the influx of cases and deaths to prevent the healthcare system from becoming overloaded. The virus will continue to spread, it'll just spread at a much slower rate. Number 4, fines are an effective measure to ensure social distancing is abided by and to slow the inevitable spread. Number 5, the development of a vaccine will take upwards of a year, as there are several steps that must be followed before it can be distributed to the general public. The CDC outlined steps include exploratory stage, preclinical stage, clinical development, regulatory review and approval, manufacturing and quality control. Therefore, as long as we are without a vaccine, the spread of the coronavirus is inevitable.